An urgent alert tonight about local emergency rooms. A new study finds a growing percentage of kids experiencing mental health crises are waiting more than 24 hours in the ER before they're assigned to a psychiatric bed. Here with more, Dr. Scott Hadland, Chief of Adolescent Medicine at Mass General for Children. Thanks for joining us, Dr. Hadland.
Thanks for having me.
All right, Dr. Hadland, the Massachusetts Health Policy Commission says the percentage of kids waiting in ERs, it's now 47% statewide. It's a big number. It's about half. So why are they stuck in limbo for so long? Not enough care providers?
That's exactly it. There's a huge need for mental health care for kids, and it far exceeds the actual availability of mental health care beds and clinicians that are available to treat them. And actually, to be clear, and we've talked about this on this program before, Massachusetts actually does better than most states in the country. So this is something that is a challenge everywhere across the U.S. And actually, the bar is really quite low. So even as we are better than others, we still have so much work to do. Just to give you a sense of the roadblocks that come up for families, a typical scenario might be a teenager that I care for who is struggling with depression and thoughts of suicide. Family takes them to the emergency department where they're seen and evaluated. And, a mental health professional says, hey, you need a higher level of care. You need to go to a mental health facility. But unfortunately, many mental health facilities don't have a bed available. They may have a long wait list. They may not take the patient's insurance. If it's the weekend, they might not be able to accept the patient over the weekend. And there's all these things that come up. And so you can just imagine that, you're faced with a scenario in which a family waits for days and days to get the care they need.
Yeah, and desperate for that care. So these are folks, again, heading to the ER. Is there something like an urgent care option available, like we see for other medical issues?
Yeah, Massachusetts has been innovative in trying to roll out what they call community behavioral health centers. These are health centers throughout the state that are staffed 24 hours a day, 7 days a week, and do some of this crisis management. And so folks can look for these behavioral health centers in their own neighborhoods and try to figure out what's close by. Families can also connect with the Massachusetts Behavioral Health Helpline. They have a website. It's masshelpline.com. And this is a set of services that I use very commonly in my own clinical practice.
All right, so you've talked with some of these kids. What do they tell you about their experiences?
Yeah, I've cared for so many patients and families who have been down this road. And almost by definition, this is one of the lowest moments in a child's life. And they end up spending those moments in the emergency department waiting for the definitive mental health care that they need, right? My colleagues in pediatric emergency medicine are wonderful. The doctors and nurses are incredible, but even they will share that, the emergency room is not a therapeutic place for a child who is struggling and in crisis, and it's a tough place for families. And meantime, while patients are waiting, they're not getting the health care that they need. I guess the positive twist I would put on this is that if we can expand access to mental health care for young people across the state, we have fantastic outcomes, and families, I've seen it with my own two eyes, do really well. Patients do really well, have great outcomes. We just need to get them the care that they need and get them connected.
Okay, Dr. Scott Hadland, as always, thank you.
Thank you.